I think
What maybe you can
Isiolo.
Isiolo.
It was a name that even public health officials at Afya House could not avoid today. A story about a people reduced to a practice many have continued to find puzzling. Rewashing protection because they either cannot afford or even gain access to, and even worse.
Kuna makaratasi, yani kwa sababu unaogopa. Hii makaratasi inaekongwa hii sukari ya kilo 1. Unaweza tumia, unaweka 2 unafunga.
Well, it may be one person using it 5 times.
It may have been a laughing matter here, but for Isiolo residents, it remains a matter of life and death.
Unaogopa kutumia hivyo bila karatasi. Sasa tunaogopa kwa sababu hakuna mtu anaweza kubali roho yake ikufe.
Na kubali kutumia karatasi kwa sababu ya kunajali maisha yangu ndio nisiweze kupata ile maradhi ya ukimwi.
And so why would a small community in the remote Isiolo region fail to access a commodity the government had promised to distribute for free?
It remains a challenge. I agree with you. It remains a challenge in making condoms accessible universally.
We have procured vehicles and caravans that will be then available to transport these condoms to the interior, and we're also partnering with community-based organizations to be able then to deliver those to the farthest in terms of distance. But we must appreciate that also delivering this requires an infrastructure that is already there.
Okay, let's say for argument's sake that we pardon the Ministry of Public Health for the challenge it says it has in terms of distribution to people who live in the interior areas such as Isiolo. But this is a ministry and a government that promised Kenyans that it was going to distribute free condoms in and around cities and towns in public places. So here we are at point 0, the Ministry of Public Health. Let's find out if they have been able to distribute condoms in their own washrooms. Let's check. So this is the dispenser, the condom dispenser in this washroom, and looking in it, there is no protection, no condom at all. In the men's washroom at the same ministry offices, the situation is even worse. The dispensers here serving another purpose altogether.
Kenyans have really accepted the use of condom as a very effective tool in the prevention of HIV/AIDS. We've seen an increased demand and usage of condoms in this country to an extent that there's now too much demand for condoms worldwide. We've now reached a situation where the supply does not meet the demand.
In Kisumu, there was nothing to hide. The dispenser at this local bar remaining empty, and such residents complaining of a commodity they want easier access to.
Condom bwana, hapa hakuna hapa Kenya bwana. Watu wanatumia jiwala, inastahili kuwe mingi bwana.
What we had projected was less than what the demand was. That's one. So we have learned from our mistakes. Is that there is an increased demand for condoms.
That demand, 20 million condoms per month, an amount the government cannot supply, seeing a shortage of 8 million condoms each month.
Kenyans have become very active.
Evelyn Wambui, Citizen Live at 9.